And actually, in 1945 onwards, it was community water defluoridation began, meaning that in other places, they actually don't have fluoride in water. So what they were doing is they were adding fluoride in water in a bid to ensure that they strengthen the teeth as a way of fighting dental caries. So what are we saying? In modern dentistry, we have fluoride used in toothpaste. We use it in varnishes, in gels, in mouth rinses, and we actually even do fluoride application. We do it, and I do it as a dentist. But here is the situation we are in. We are talking about fluoride use in dentistry, but also we are saying that there is a problem that we are having in the name of dental fluorosis. So we have talked about the angel, but I just want us to look at the chemistry behind fluoride as an angel. So what happens? You can see we have hydroxyapatite complex, that is the calcium phosphate and hydroxyl ions. That is what we call hydroxyapatite. It is found in teeth. It is also found in bones. Note that because we are going to revise that later. So what happens is the hydroxyl ions is replaced by fluoride. When you use the toothpaste, when the dentist uses a varnish, when you use that mouth rinse, topically, that is to mean without you swallowing, topically, the hydroxyl ions, there's usually some mineral ion exchange on the teeth. And so what is formed is a fluoroapatite. You can see the F2 has replaced the hydroxyl ions. So her fluoroapatite is usually strong. It's very strong, and it is actually resistant to acid dissolution. Remember, what causes caries is that you have bacteria in the mouth that digests the sugars and releases acid, and that is what causes the dissolution of the tooth to cause a decay. So the fluoroapatite is actually resistant to decay. The other way is that fluoride actually interferes with the enzymatic activity of cariogenic bacteria. So in those two modes, we call fluoride an angel. Yes, so why devil? WHO recommends that fluoride levels should not exceed 1.5 milligrams per liter. Please note 1.5 milligrams per liter. High ingestion. Remember, I talked about an angel when fluoride is applied topically. But when you ingest it, when you take it, when you give your child with formula milk, when you're diluting, when you're taking it in tea, when you're cooking with it, and you ingest into your body, it has deleterious effects on your health. Now, high fluoride ingestion over a long period of time in a child less than 8 years will cause dental fluorosis. Why is it important? Because above this, even if you're exposed to high fluoride over a long period of time, you will not have dental fluorosis. So am I saying that adults or people who are older than 8 years should have no problem taking high fluoride? No. We are talking about the devil. In one way, if you have high ingestion, very high ingestion of, sorry for that typo, high fluoride ingestion within a short period of time, you can have acute fluoride toxicity. This is usually common when children take fluoridated toothpaste. Remember the fluoridated toothpaste for young ones? It usually has some mint, it has some flavor. So some actually take it. When they take, it usually has very high fluoride. In fact, it usually has like 1,000 milligrams per liter, parts per million. So that is very high fluoride. So if a baby ingests that, they will present with severe vomiting, diarrhea, hypersalivation, abdominal pain. If you suspect that acute fluoride toxicity has happened, seek medical attention immediately. So this is when you have high fluoride within a short period of time. Remember, I talked about dental fluorosis when you have high fluoride exposure through a long period of time. So I asked you, if you take high fluoride and you are above 8 years, what will happen? One thing that can happen is that you can have skeletal fluorosis. I'm talking about high fluoride over a prolonged period of time. So, what is skeletal fluorosis? I talked about the hydroxyapatite complex. Yes, I talked about this complex that we have over here. So, what happens is that there is a fluoroapatite which will be formed on bone. Remember, on teeth, we said it will be strong, it will help the teeth fight cavities. But now, when it is on bones, it actually forms osteosclerosis. This is because when during the bone remodeling, yeah, it is usually a balance of osteoblasts that deposit bone and osteoclasts that break down. So what happens is that you will have a very thick bone, very high bone density, and mostly bone density does not mean that actually you'll be strong. It means that actually your bones will be very fragile and you can actually end up with pathological fractures. In early stages, actually also, the fluoride gets deposited on your tendons and on your ligaments. So you can actually present with joint stiffness, painful joints, reduced mobility. In advanced cases, like what I have on the photo, you can actually have severe bone deformities, you can have spine rigidity, etc. You can have difficulties in walking. Like, for example, this person, you can see a photo taken, although they extracted from the internet, but it's a real case from Baringo. Neurological effects. Neurological effects. For example, when a mother takes high fluoride, the fluoride actually goes through the placental barrier. So what happens is you'll have prenatal exposure, which has been associated with a low IQ in children, and also neurodevelopmental delays. As for the renal, if you have high toxin, it will actually you can actually end up having some renal problems. Endocrine, I can give an example. It causes calcification of the pineal gland. Yeah, and this will give you distorted sleep patterns. Exposure to air, fluoride in air, high exposure can actually give you asthma-like problems. We have a lot of work that has been done to show that adverse pregnancy in outcomes, for example, preterm and low birth weight babies, spontaneous abortion, stillbirths, a lot that has been done. You can actually Google and you see that there's a lot of research that links high fluoride exposure to adverse pregnancy outcomes. We also have GIT issues. For example, when you have high intake of fluoride, it usually forms hydrofluoric acid that leads to destruction of the mucosal damage. It can also lead to the imbalance in the gut microbiota. And also, a lot of research has shown that there are gastroduodenal manifestations in patients with skeletal fluorosis. That is, most of them were found to have loss of microvilli. So, loss of microvilli will lead to iron absorption impairment, that will lead to iron deficiency anemia, even for example, in mothers who are pregnant, and etc. So we have a lot of systemic effects. So it's not only about dental fluorosis. It is also about us taking care of the water that we are having, so that we don't experience these systemic effects. Let us now talk about fluorosis, dental fluorosis. So dental fluorosis, I think it is very important for us to understand that it is actually irreversible. Yes, it is reversible. And as we see later, dentists do not reverse. They actually manage, they coat, but we do not reverse the condition. It is usually again due to high ingestion of fluoride, especially in cooking and drinking water. I have highlighted because we'll have a lot of people talking about I have safe cooking, I have safe drinking water, but I use the tap water for the borehole water for cooking. And I want to tell you that as scientists, when you actually Fluoride is a salt. So when you actually boil the water, when you use it to cook tea and you ensure that you cook properly, the water evaporates. And what you end up having is actually a higher concentration of the fluoride. So WHO recommends that fluoride levels should actually be less than 1.5 milligrams per liter. And in the guideline, it actually says for us who are in the tropical region, having in mind that we are in hot places, we tend to take water often. So we might actually end up having higher intake of fluoride if at all our fluoride has high high fluoride. Yeah, we might end up with higher concentrations of fluoride at the end of the day. We should actually set our local standards and we adopt them. High fluoride ingestion, I have said that dental fluorosis will be caused by high fluoride ingestion for a long period of time in a child less than 8 years of age. The other reason as to why I am insisting 8 years of age is because as a dentist, as a practicing dentist, I'm seeing a lot of mothers and parents running when the child erupts the first permanent incisor, which is the first lower incisor. At this time, I want to assure you that over 70% of the teeth have already formed. Although you cannot see them, but under the jaw, they have already formed. And that is why then we are insisting that for a child, even when the mother, when as soon as the mother is pregnant, they should ensure that they have safe cooking and drinking water so that we prevent dental fluorosis. Global prevalence, we are not the only one who is suffering this menace. We have 180 to 200 million globally affected by fluorosis. The East African Rift Valley, as you can see in the map. We also have China, India, Sri Lanka, which are major hotspots. And the sad thing is roughly 15% of Africa's area has high probability of having groundwater with concentrations higher than 1.5 milligrams per liter. Yes. Yes. Yes.
Hello, sorry for the technical issue. Just a minute as we try resolve it.
fluorosis in the adult population was 23.7%, while that of children was 41.4%. Yes, so there's a generational difference that calls to show that actually fluorosis is now higher than it was before. We have selected we have high prevalence in hotspots also in the country. For example, in Machakos, where children have over 90% of the children have dental fluorosis. Nakuru also, Naivasha. And we have the highest recorded fluoride in Lake Nakuru. That was 2,800 parts per million. Remember that we have talked about fluoride level, the recommended level being 1.5 parts per million. So previously, dental fluorosis was only rampant along the Great Rift Valley. But right now, like in the Nairobi, like I will show, Nairobi metropolitan region, we are having very high prevalence of high levels of fluoride in our underground water. Yes, and whenever we are going to look for apartments, most of us, when we are looking for apartments, we look for ample, good supply of water, and mostly we will smile when we hear that there is borehole water. But the question is the borehole underground water safe for our consumption? In Nairobi, Nairobi Water Sewerage Company in 2019 showed that the demand of water was 790,000 meters cubed against a supply of 525,000 meters cubed. So we can see that there is definitely a deficit, and we will not run away from underground water. But the question is, then what are we going to do? We have to really accept the use of treatment. Let me not talk about that. It just goes to show that we have high fluoride also in the foods that we eat. For example, tilapia, Nile fish, Nile perch. We also have makueni vegetables having very high fluoride levels. Allow me to go through this also. Classification of dental fluorosis. When you're reading research, I think it's important that we know dentists, there's a way we classify dental fluorosis. Normal teeth should be milky white, yes? But when you have very chalky white teeth that resemble the white we have on paper, then that is actually dental fluorosis. We also have dental fluorosis that comes with the teeth appearing yellow and sometimes brown. Sometimes we also have pitting and chipping of the outer covers of the enamel. I will share my experience. Allow me to just go through this really quick because of time. I want us to have some time for questions. So at Riverside Water Defluoridation Consultants, we usually administer fluoride water tests for all those people who install our water purification systems. Most water is usually pure borehole water, sometimes a mixture of borehole and council water, and sometimes council water. Yes. So what we did is we wanted to determine the fluoride level in kitchen taps, and we compare them with the WHO recommended levels. Nairobi metropolitan region covers not only Nairobi County, but also the neighboring counties, for example, Kiambu County, Kajiado County, Machakos County. And I hope, Teddy, we are still together. So we took a total of 165 fluoride test results. And what we found is that the highest recorded was 46.82 milligrams per liter, whereas the lowest was 0.03. The mean was 5. You can see really it is very high. Remember, we are saying that the fluoride level in cooking and drinking water should not be more should not be more than 1.5 milligrams per liter. Yes. The cost of management of dental fluorosis. So it has always been said, if you think education is expensive, try ignorance. And I want to challenge us. If you think that water treatment is expensive, let us wait for treatment of dental fluorosis. Let us wait for that invoice at the dental clinic. And this is just not for you as an individual, but also for policy makers, because as we'll see later, we have huge impacts. The dental fluorosis really laying a huge burden on the already straining healthcare system. Access to dental care. We only have 2,000 dentists in the country. Yes, serving over 55 million Kenyans. So some people may never get to see to be served by a dentist. Yes, and remember, these dentists mostly they're usually highly concentrated in the urban areas. Masking is a mode of treatment where a dentist uses filling material to cover. Remember, when we were starting, I said dental fluorosis is not reversible. We do not treat, we just manage. So we use a filling material and we cover the tooth. And that one will cost 8,000 per tooth in a private hospital. In a public hospital, which are countable, it will be 3,000. And we usually fill at least 8 teeth on the upper jaw. Yes, it is 64,000. And even for in a private clinic, when you do 8 teeth, it will be 24,000 in a public hospital. Remember, this again is not even covered by most insurance companies. Veneers and crowns, it's 40,000 in a private hospital. It is not available in most public hospitals. And again, we are looking at 8 teeth. So you can really see that it is really, really expensive to treat dental fluorosis. So beyond the invoice, there is an increased oral health problems, because I said that when you have dental fluorosis, most times you'll have pitting of the tooth. So you'll have poor plaque control. Plaque control is a biofilm that covers the tooth. And this biofilm, it is not well controlled when you don't have a smooth tooth. Most patients will come with teeth hypersensitivity and really very high restorative treatment needs. This psychological and social effect is something that we are seeing in most teenagers, where someone, especially in this time and age when we are having a lot of, high aesthetic demands, really a lot of value put in how you look. So we have low self-esteem due to stained and mottled teeth, a lot of bullying in school, people having low self-esteem and negative body image about themselves. And in children, this will actually end up affecting their academic performance. And some, even if they do well in school, some may never get to do what they love. And the reason is there are some careers that are really keen on aesthetic standards. Because these jobs require a lot of public interactions. For example, in the front office, in journalism, and many others. Yes, and in special forces, that is in the police and in the military, they usually disqualify you on the basis of dental fluorosis. Not really because they need high aesthetic standards, but I think because of, if you have dental fluorosis, you definitely have skeletal fluorosis, and therefore your bones are not strong enough. So we are talking about a very high economic cost to family and health systems because of the high cosmetic treatment, repeated dental visits, and when you're going for the dental visits, you'll not be very productive because of the loss of time while you're seeking treatment. So really, dental fluorosis is a high economic burden. It's causing a high economic burden. When we look at the policies that are looking at into this issue, this public health concern in the name of dental fluorosis, we have the Kenya National Oral Health Policy of 2022 to 2030 and Kenya National Oral Health Strategic Plan 2022 to 2026. Both recognize dental fluorosis as a huge contributor to oral disease burden. In fact, they set a target to reduce the prevalence of dental fluorosis among children by 50% by the year 2030. So it really prioritizes what we are doing. We are talking about safe cooking and drinking water as a way of preventing dental fluorosis in order to reduce the oral disease burden in the country. So we also have the Nairobi Declaration on Dental Fluorosis, Teddy, can you hear me? Please confirm that you can hear me.
Yes, yes, we can hear you.
Thank you. Nairobi Declaration on Dental Fluorosis. This was actually an initiative of the World Dental Federation and Kenya Dental Federation, where they gathered dental associations in East Africa, Kenyan stakeholders, like, for example, Riverside Water was part of the team, and they really declared that dental fluorosis is now a public health concern through Nairobi Declaration on Dental Fluorosis that was done in August 2023. So we are going to look at the details of the Nairobi Declaration on Dental Fluorosis. It emphasizes on key priority areas that really need to be looked at. One is that you really cannot fight an enemy that you don't know. So we need to map fluoride, and we see where the fluoride is really high. We need to sensitize, creating awareness on high fluoride consumption and also the deleterious health, effects, not only to health, but also to our bodies, the general health. We need to have policy efforts. For example, real estate developers, they are all sinking boreholes in order to provide water. But the question is, these homes, they are killing dreams. These homes that people are buying are just, destroying smiles and future generations and even our bodies. So we really need to have policy that safeguards someone, even if you don't know about fluoride. Then the policy efforts that really protect Kenyans. Testing of water by water vendors. Unfortunately, we have a lot of water vendors that are just doing microbial, killing microbes. So when you take that water, you will not have like acute infection. However, you will ingest high ions like fluoride that with long-term use might end up having deleterious effects again on your health. We need to have defluoridation capacity building efforts for both small and large scale. Yes, and probably even tax exemption for defluoridation equipment so that people can really afford these equipments, and even local production on defluoridation equipment. We have a lot of defluoridation techniques that are available. Sorry for this. So together we have a lot of defluoridation techniques that we have. I allow me not to really go deep into that, but the most common one is the RO system. The RO system, however, the RO system, it has its own disadvantages. For example, there is loss of water, it needs electricity, and therefore it is not something that can be available for everyone. We have defluoridation techniques, for example, that use hydroxyapatite that are actually currently they are in the country, and they are cheap because they can even take 1 year to change the hydroxyapatite, and really they are very cost effective for both households and the communities. So what is the way forward? The way forward to a fluorosis-free future is that we need to adopt what the Nairobi Declaration on Dental Fluorosis did or proposed. And for me, I thought of SMART. We survey, we measure the problem, we have to act, we have to review and keep monitoring, and we have to transform policy. And if I go deep into it, survey, we have to do fluoride mapping. For I know we have a lot of researchers around. This is a key area that needs to be done. We have to do water testing that should also be accessible and affordable to people. And allow me to say, as Mama Maji, actually make sure that we have accessible and affordable, accessible water testing. For you, we have to measure and quantify the problem. For example, what is the prevalence of dental fluorosis in the country? The last one that was done by the Kenya National by the Ministry of the Health through Kenya National Oral Health Survey was done in 2015. A lot has happened since 2015 is now 11 years. So we need to see where we are at. And also we need to look at what is really the health impact of high fluoride exposure. We need to act. We need to create awareness on the deleterious effects of high fluoride exposure. We need to demystify myths around fluoride. For example, there are people who think that so long as your underground water is not salty, then it doesn't actually have fluoride. Whereas I want to tell you today that fluoride has no taste, fluoride has no smell. So you need to test your water. Yes, there are some people who think boiling water can actually can actually remove fluoride. We have talked about that today, and we have said that actually when you boil, you actually now take fluoride in higher doses. We need to have partnerships between governments, associations, and governmental organizations because we need some form of synergy. It is not a one-man show. Someone has to do something from the government, associations, for example, the Kenya Dental Association. I want to give them a really thumbs up because of the great work that they are doing. Even individuals, I'm currently running a fluorosis free future campaign. And therefore, we need to come together so that we implement solutions. We need to have mass water defluoridation points by the national and county governments in villages, schools, and hospitals. If I give you an example, as a parent, I have said that fluorosis will will affect a child up to 8 years of age. But children start school when they are 4 years of age. So as a parent, you will do that. But when the child goes to school, they are taking water, borehole water with high fluoride. The schools are using that to cook. And therefore, we need to have this message even in schools that we need to defluoridate our water. Multidisciplinary approach, we have all seen that this one, climate change has really caused us to use underground water. We need to have development of defluoridation equipment locally, and so that we have local solutions for ourselves. We need to have to do a lot of research and do a lot of research. We need to keep monitoring and reviewing our water, and especially also the public health department needs to target the water vendors because what they do, some of them are just installing the water purification equipment and they just let it run for life. So long as there is a UV light there, then someone will just let it run for life. So I think the public health department has a huge role here in protecting the public. We need also to evaluate the programs that we establish. Transform policy. I have talked about estates where developers are sinking boreholes right, left, and center. And even when they are warned that there is high fluoride, they end up connecting the water to the kitchens. And this is destroying our children's teeth. It is destroying our children's futures. So we really need to have policies that protect our children. Yeah, we also should consider tax exemption for water defluoridation equipment. And I think I will allow us to have some questions. And I have a video that I wanted to share for 2 seconds, but I'll allow Teddy to guide me. Teddy, I hope you're still together.
Hello, yes, we're still together. Thank you very much for the insightful presentation. So yes, I think I can actually share the short video. Then after that, maybe we can get into the Q&A session, if that's okay with you.
Thank you. Thank you. That will be awesome.
Okay, just a minute. Let me share my screen. Hello, can you see my screen?
Yes, maybe you can rewind it.
Okay, yes.
Hai, sasa leo mama maji ako kwa mtaa na leo tuko Kasarini, Kiambu. Haya basi njoo.
I'm Ruth Wangoi Gatua, and I am a retired teacher, teaching Kasarini Primary, which was more affected by the teeth decay due to a kind of water, I don't know which one. And I used to be worried about these teeth. I couldn't understand. You could see a child is growing, but ana bed hivi. Unamuuliza ni nini, you see the child is not strong, and you could notice there is something that is wrong.
Ndio sijui ni Flouride kwa mingi sana. Flouride hiyo. Wakati huo tukiwa wachanga tulikuwa tunaona hayo wengine. Wako wasa hata kuliko sisi. Na wale ndio affect hata joint zao zikanika. Wakawa kama wamepalala hivi. Wengine unakuta meno zenyewe zinakatika zenyewe.
I think we can, it's okay now.
Mwingine analea.
We can exit and welcome the questions. Maybe
Okay.
Teddy, you can pause.
Okay, yes. So, thank you very much once again for the insightful session. I also would like to thank your attendees for staying with us despite the minor technical hiccups. And so we do have a few questions which I'd like to direct to you, Daktari. So Martin Ombugu asks, what is your opinion on this debate of fluoridated toothpaste that affects the pineal gland?
Yeah, so thank you so much for the question. Now, as I mentioned, toothpaste, when you use topically, it actually strengthens your tooth. There is ion exchange where the hydroxyl ion is replaced by the fluoride. So it forms hydrofluoroapatite. It forms fluoroapatite crystals that are resistant to dental decay. And therefore, as dentists, we advocate for use of fluoridated toothpaste. What we are saying is if you ingest high fluoride through your gut and it gets absorbed, it can actually calcify your pineal gland. And that is why I mentioned that with high ingestion of fluoride, it can actually cause calcification of the pineal gland, which will do what? Which will actually distort your sleep cycles. So as for fluoride, we are saying we use fluoridated toothpaste. However, we treat our water so that we don't ingest high fluoride in cooking and drinking water. I hope that helps.
Yes, thank you. I think you've also answered Kabara Omundi. In case Omundi, your question has not been clearly answered, you can still maybe write a note on the Q&A, then I'll go ahead and read it once again. So Kabara had also asked, what will be the source of high fluoride in boreholes and also in large water bodies?
Because we are in, it's usually because of the volcanic action. Yeah. So what happens is when water goes through those rocks, it ends up extracting fluoride from the rocks. And therefore, when we dig boreholes, we are taking high fluoride from the water. Yes, basically, it is that the water is getting high fluoride from the rocks. Yes, does that answer?
Yes, I think you've tackled the question clearly as well. So, Ruth Litoro asks, where should we test water, or are there organizations that do that for the common mwananchi?
Yes, and that is so we have Kenya Water Institute. But I also do personally, I help and I make water testing easy and accessible. So what you can do at a cost of 1,500, our technicians will sample or we can organize for pickup and we'll give you the results. We also test.
Okay, just
Yes,
to
so you
follow
can.
up on, sorry,
Mhm.
just to follow up on Ruth's question, how long maybe should somebody wait for the test results?
So it is usually less than 4 working days. So in 4 working days, your results will be out. And we are saying that testing, for example, we do it at 1,500. And when we do that, just look at the cost of the fluoride, of the treatment of dental fluorosis. So it's really worthwhile to know the water that we are consuming in our households.
Okay, on to the next question. Frida Moraga asks, is dental fluorosis the same as hypermineralization?
So dental fluorosis, I wouldn't say, I would not. So dental fluorosis, let me just say what happens is that when the tooth is forming inside the jaw, during the mineralization process, the fluoride distorts that. Yes, and there's a huge biological process that happens. So what happens? The mineralization is distorted, and when the tooth comes out, when the tooth erupts, it now picks up the colors from the foods that we are eating. Yes. So I would not say it's straightforward hypermineralization, but I'll say that dental fluorosis is irreversible. It affects your tooth structure because it affects the mineralization of teeth.
Okay, thank you very much for that. So, Nduguyu Kere asks, should children under 8 years old use fluoride-free toothpaste that is in high fluoride areas?
As we are saying is, thank you, my senior. It's good that we clarify this. Should children under 8 years use fluoride-free toothpaste in high fluoride areas? We are saying that it is important for us to use fluoridated toothpaste. What happens is that for children and for these children, you just ensure that the child does not swallow the toothpaste. But otherwise, toothpaste with fluoride, it's very important because it helps in strengthening the teeth. So let us move away because there are very many people out there who are talking about fluoride free toothpaste. We are saying that let us use fluoride, fluoridated, fluoridated toothpaste. In children with high fluoride areas, let us ensure that we have water treatment for them and therefore they have safe cooking and drinking water just like any other child should have. And then we give them fluoridated toothpaste so that we protect their teeth. I hope that helps.
Um, Also, Evelyn Areda asks, why are milk teeth not affected by fluoride?
Why are mixed? They are actually affected. For example, the reason as to why during my fluorosis free tour, I toured Kasarini, it is because, as I mentioned, we recorded a very high fluoride rate of 46 milligrams per liter. And the guy by the name Jehia, who has actually allowed me to use him for education, he mentioned that even children who were young were being affected by fluoride. Yes, they have dental fluorosis. It's usually not common, but it happens. The reason is, as we mentioned, that fluoride passes through the placenta barrier. And remember, the milk teeth, mineralization of milk teeth happens when the baby is in their mother's womb. So yes, milk teeth can be affected by fluoride.
Okay, Ruth Litoro once again asks, is it safe for people with severe fluorosis to use unfluoridated toothpaste, for instance, toothpaste called Dabur?
For me as a dentist, I'm saying that let us use fluoridated toothpaste. Whether we have dental fluorosis or not, let us advocate for use of the fluoridated toothpaste. And it is because I have said that fluoride in itself strengthens the teeth. The only other option that we are having currently in the dental space is use of hydroxyapatite based toothpaste. Yes, so hydroxyapatite is being used to replace fluoride. However, there is not so much research that has been done. Therefore, if someone is able to get hydroxyapatite toothpaste, they can. I will not personally advocate for use of non-fluoridated toothpaste. And I think also as dentists, we advocate for use of dental fluoridated toothpaste.
Just a quick one. How safe is mineral water? That is the mineral water that we buy from our supermarkets.
And I think that is why we have said we need to safeguard Mwananchi. Public health officers, we need to hold hands, we need to test, because as it is right now, I cannot really comment on whether it is safe or not. So we really need to have like papers that have been done to test the water, so that we know that these brands they have the right quantity of fluoride in the water. So I really cannot comment on that. But what we can do, what you can do at a personal level is, I feel, don't shy away from testing the water that you're using for cooking or drinking. Go test it even independently, and then now we can take the conversation from there.
On that note, Daktari, now
Yes.
that we have to test the mineral water in our supermarkets,
Yeah.
now is the rainwater safe from fluoride?
Yes, actually, rainwater, I actually advocate for, I think I missed that in my PowerPoint, but personally, I usually say that for those people who are able to harvest rainwater, store in a tank, let that water be specially for cooking and drinking. If you have well water, if you have borehole water, use that for, because water, we don't only use it for cooking and drinking. We have washing, we have flushing our toilets, we have cleaning. So have specific water, harvest rainwater, and even advocate that in the communities. Yes, harvest rainwater. It is a very safe option as compared to having underground water.
Okay, I can see the questions are really coming in. So Rosa Keller is asking you to explain once again how high exposure of fluoride can affect the kidney or bring about kidney issues.
Yes. So basically, when you have high ingestion of fluoride, because kidneys, at least from my medicine, I trained also in medical school. At least I know kidney. It's really for clean, quote unquote, for cleaning your blood. Yes. So if you overpower your kidney, I really can't tell properly, but I should go read. Maybe I should have mentioned that. But it has been shown to have to cause renal issues. Yes, I think we had some glomeruli over there. Remember in the GIT, I think I can really well explain in the GIT what happens. It actually causes disturbance of the microvilli. So I would think the same would happen to the kidney issue. But thank you for the challenge. Let me go read about proper reading about how it affects the kidney issues.
Thank you very much. Someone is asking, can fluoride stained teeth be cleaned white? So I think I can answer that because I've learned something. So
Yes,
the
go ahead.
stained the stained teeth can maybe what can happen is they are placed veneers, if I'm not wrong, Daktari, or they can only
Excellent.
be coated.
Yes,
But
excellent.
you cannot cure the fluorosis itself. Also, somebody asks you to clarify how they can defluoridate water, especially that is home supply water, water that is just for home use. Thank you.
Yes, I personally do that. and I supply water purification systems. And right now, I think at Riverside Water Defloridation Consultants, we are in the next few weeks, we will be able to launch a household water defloridation system that will be less than 9,000, so that no child, no parent has a reason not to defluoridate their water. So that is basically what I do, water defluoridation, in a bid to prevent dental fluorosis. Because honestly speaking, as a dentist who's been practicing for 13 years, and as a parent, as a mother, it kept breaking my heart, seeing children with dental fluorosis and without knowledge. And that is why I think, as Mama Maji, I came out strongly to say that, wait a minute, dental fluorosis is actually 100% preventable. And for me, as much as I am supplying water purification systems for household, for schools, I am also saying that it's a call also to the policymakers that, wait, let us have a conversation, because every child deserves. It's actually a right as enshrined in our constitution, and therefore we have to ensure that we have safe cooking and drinking water for our children, for our communities, so that we have healthy smiles and healthy futures.
Thank you very much, Dr. Wendy Rachel has quite a good question. She says, thank you very much for the amazing presentation. And also, why is fluoride considered essential in dental care, despite some concerns about it? And are fluoride-free toothpaste effective enough just for preventing cavities?
Thank you. That is a good question. I think we might have answered, but allow me also to repeat the question, to repeat the answer. Yeah. So we have said that fluoridated toothpaste, what happens is, in the tooth we have hydroxyapatite. What happens, there's usually ion exchange. So when you're brushing topically, when you're using the fluoridated toothpaste, there is usually some ion exchange, whereby the ion, and that is why even as dentists, for example, tonight, please, after a dental presentation, make sure you brush your teeth. We usually recommend that you actually don't rinse, especially at night, so that you let the ion exchange happen for longer. Yes, you extend the ion exchange. So basically, hydroxyapatite is weaker than fluoroapatite. The fluoroapatite happens when you use fluoridated toothpaste. I didn't get the other question. Let me read.
Okay.
Let me read. Would you kindly read for me the next part of the question? I think I forgot.
She was asking, are fluoride-free toothpastes effective enough for preventing cavities specifically?
No, fluoride-free toothpaste, let me put it like this. It's just that, like using soap. So there is basically no ion exchange that will happen. You will just have some good lather, that is some foam forming. You will clean, you will feel fresh, but there's no ion exchange. So please let us use fluoridated toothpaste.
Okay. So there's an attendee who's asking, in areas with naturally high fluoride levels, how should specifically clinicians balance caries prevention with the rising burden of dental and skeletal fluorosis?
In areas specifically?
That is,
Let
in
me.
areas with naturally high fluoride levels, how should clinicians specifically balance caries prevention with the rising burden of dental and skeletal fluorosis?
I think it is upon us as clinicians, first, to say that we need to prevent this issue of dental fluorosis and skeletal fluorosis. So I want us to understand that there is optimal fluoride level that we recommend for caries prevention. That is in the water. Remember when I was talking about the history of fluoride, and I said in other parts of the world, for example, in the Western world, they actually fluoridate their water. Yes, so from 0.5 to 1 milligrams per liter, it is known to be the optimal water level. So we are not saying that even in drinking water, you have nil. You can actually have 0.5 to 1 milligrams. However, like at Riverside Water Defluoridation Consultant, realizing that we have other channels, that we have other intakes through which we have fluoride, we say 0. Just below 1 milligrams per liter, it is okay in your cooking and drinking water. So as clinicians, let us differentiate two things. Let us not say that people with high in regions with high fluoride to take high fluoride to prevent dental decay. No, we are saying very high fluoride will give you dental fluorosis and it will give you skeletal fluorosis. However, we are advocating for use of fluoride toothpaste. So what then should people in high fluoride regions do? The policymakers, the county governments, the individuals should ensure they have water treatment so that they have the right amount of fluoride in their water. And then what should they do? They should also use fluoride toothpaste. Okay? Because fluoride toothpaste will strengthen your teeth. Did I make sense, Teddy?
Yes, you did. And in the interest of time, I think I'll only take maybe three, four more questions. And also, I can see most of the attendees are asking for ways they can reach you so that they can get their water tested. So I think it would be helpful if you shared your the contact information slide once again.
Okay.
And also, Penny Mwange says, thank you so much for your presentation. Beyond consumption and cooking of water that is high in fluoride, there are foods that we consume daily that concentrate fluoride, such as tea, kales, and other green leafy vegetables. And also, she's adding consumption of this can contribute to dental and skeletal fluorosis. So, Esther Muinga is asking, what can parents do to strengthen the bone and teeth of children that have already been affected by fluorosis?
Yeah, allow me first to appreciate the Chief Dentist at the Ministry of Health, Dr. Penny Mwanke. Thank you so much for joining us and also for your insights. And so, as I mentioned before, for the parent who's asked what they can do, please visit a dentist because, as I mentioned, teeth with dental fluorosis, they have a high risk of developing other problems. For example, gum disease. For example, because even if the baby or the adult brushes, they may not be able to remove the plaque. Allow me to say the plaque is a remnant uchafu on the teeth because the teeth mostly are usually not smooth. So ensure you keep your dental appointments. As dentists, we advocate that you visit your dentist at least twice a year. Ensure you use fluoridated toothpaste. Ensure you also avoid sugary foods. Ensure the basic oral health practices that we usually recommend for dentists. Ensure that you have that. Yes, but also as a call for everyone listening to me tonight, please let us take, and especially for the people who are using underground water, please let's take care of each other. Let us help spread the message. I am currently running a fluorosis free future campaign. Please follow me on social media pages. I will enlighten you on more. We may have forgotten one or two, three things. Please, when you're visiting, when you're going for baby showers, other than just buying for them fridges and microwaves, please buy for them water purification system. You will have saved that child a great deal in the future. Let us spread the message because unfortunately, not many people have the privilege of this information. Because previously, especially in Nairobi,
Okay, hello. Good evening. I think we've lost
take care
Dr.
of each other. Let us
Again.
take care of ourselves. Yes.
Yeah, sorry, we had lost you for a minute. Just the last question, the very last question, then we're going to wind up, and you can as well rewatch the webinar or revisit the webinar on the YouTube. That is KNH Research YouTube channel. The last question, Daktari, for the parents with kids whose milk teeth have been affected by fluorosis, is it hopeful that once the milk teeth come off, the other teeth won't have fluorosis?
Yes, unfortunately, it's not a must. Remember, we have said so long as that child has been exposed to high fluoride for since they are born. Yes, so the adult teeth start mineralization as soon as the child is born. I would say that. So if they were exposed to high fluoride, there is high chance that even if you're not seeing those teeth, probably they have already been affected by high fluoride. And that is why we are saying, let us ensure that we have safe cooking and drinking water. When a child is from as early as 0 age, when they are in their mother's womb, to 8 years of age. But then we are also adding that safe water is a right for everyone.
Thank you very much, Dr. We have come to the end of our webinar. So, for some of the attendees asking for names of the toothpaste that have fluoride, you can confirm before you purchase the toothpaste that is in the ingredients, or yes, just confirm if it has fluoride. Most of them have it noted somewhere around the maybe the box or the toothpaste tube. Also, thank you very much, every one of you, for sparing time and joining us for today's webinar. Also, keep an eye out on the email system for our upcoming webinars, that is throughout the course of the year as well. So, my apologies once again for extending your time. That is 7 minutes past the time that we had set aside, and thank you very much for your patience. Have yourselves a lovely evening as well. Thank you.
Thank you, Teddy. And thank you, everyone.